Data from the Office for National Statistics shows another big rise in COVID cases. More than 4.25 million people in the UK had the disease in the week to last Saturday, up 1 million in just 7 days. Look at a chart and you can see how the infections have surged since the second half of February, driven by the more infectious BA2 subvariant of Omicron and the lifting of all restrictions. And they're now close to the record peak for the pandemic in January. The highest rates are in young children. More than 8% had COVID. But there will be more concern that 5% of people over 70 had the virus, and they're, of course, much more likely to become seriously ill. So are they? Well, data from the UK Health Security Agency shows hospital admissions in people over the age of 75 are now higher than they were at the peak of the Omicron wave at the start of the year. The hospitalisation rate for every 100,000 people over 85 was 178 last week, compared to 158 in January. And in people between 75 and 84, it was 74 last week, compared to 70 in the January peak. Now, that looks alarming, but the Health Secretary has said 60% of people testing positive in hospital are being admitted to treat other conditions, not COVID. For now, the vaccine appears to be holding up reasonably well, but it's beginning to wane, as shown by other data from the Health Security Agency. It looked at people with respiratory disease needing oxygen, ventilation or critical care. Now, immediately after the booster, the jab was 95% effective at preventing such serious disease. But 15 weeks after the booster, that had dropped to 87%. It's a relatively small drop, but if lots of older people are being infected, it could add up to lots more hospital admissions. And that's why everyone over 75 is now being urged to book a spring booster to top up their immunity.